Now, last week, during a town hall question about healthcare, a Republican representative basically stepped in it. And he stepped in it hard. Now, I'm going to show you a video of Representative Raul Labrador, who was responding to a woman at a town hall meeting on Friday about how the lack of access to healthcare would basically lead to people who didn't have the healthcare anymore basically dying. Well, here's what he said in response to that.
You're mandating people on Medicaid except dying. You are making a mandate.
No one wants anybody to die. You know, that line is so indefensible. Nobody dies because they don't have access to health care.
Nobody dies when they don't have access to health care. I mean, health care is completely 100% optional. Is it? Really? No, that line is... No. Saying that, and it's ironic, right? He said that line is indefensible, saying that people will die. No. What you just said, that was indefensible. You know why? Because facts. You know, facts, numbers, statistics, reality. That's why what you said is indefensible. Now, I want to show you, and I'm going to show you some examples of why he is full of shit. But before that, I do want to read you a statement from Labrador's office. And this is after he cast his vote for the AHCA. Quote, all across Idaho, families and small business owners are struggling to keep up with skyrocketing healthcare costs caused by Obamacare. Is it really caused by Obamacare? Obamacare actually slowed that down. People of Idaho know Obamacare is a disaster and want it fully repealed. Again, that's not true. Since I was first elected to Congress, I've been working to repeal Obamacare, and that includes opposing the first version of the American Health Care Act. To be fair, he did oppose the first version. Now, whether it was because it was not conservative enough or because it was too conservative, well, I think we know the answer. He's a member of the Freedom Caucus, and I believe he was in favor of making it more punitive, even more conservative. Now, as far as the AHCA being very unpopular, it's actually more popular than it ever has been. And most people polled, they don't want you to destroy it. They actually want you to fix it. Now, of course, I've said before, there really is no fix that's going to be any more effective than a Band-Aid. Really, what you need to do is go to a Medicare for all system. That is the most efficient healthcare, and it's also universal healthcare. It covers everybody. Now, furthermore, he says, we have negotiated legislation that keeps our promise to the American people to lower healthcare costs while also protecting those with pre-existing conditions. That is not true. That is not remotely true. He is literally lying to your face. This bill, which hasn't even been scored by the CBO, by the way, will likely raise costs for seniors, right? See, people who are seniors and people with pre-existing conditions. It'll also raise basically premiums for everybody that isn't a rich 20-year-old. That sucks. Older people with pre-existing conditions, for example, will pay up to 475% more for their healthcare premiums. Now, how's that going to happen? Well, it happens because of high-risk pools. Now, high-risk pools, I've talked about that story in Minnesota, which was the most successful, by the way. The most successful high-risk pools in America came from Minnesota. Even that, somebody with a pre-existing condition who was about 46 years old. They talked to this guy. He was paying $18,000 a year for his premiums. That's ridiculous. Now, yes, the price will go down for some. But the reason that happens is because older and sicker people who are not as fortunate as that one gentleman who could afford to pay $18,000 a year just for health insurance premiums, well, they were priced out of the market. Now, of course, the AHCA, actually the AHCA bill that passed the House did have $8 billion more. Now, that equals about $130 billion that will be put towards these high-risk pools, right? So they're like, okay, let's mitigate these costs by putting a little bit more federal money into these high-risk pools and make them work. Well, healthcare experts and a lot of Democrats say, nope, that is not enough to bring down these costs. You need even more money. You need a lot more money into these high-risk pools. Now, of course, the AHCA also changed and added a whole bunch of other things that were going to be counted as pre-existing conditions for things like acid reflux. Well, it looks like I'm screwed. I'm going to a high-risk pool. C-sections, anxiety, depression, obesity, stroke, pending surgery or hospitalization, pregnancy even. So essentially being a woman is a pre-existing condition. Wow. Not only that, but the pregnancy also affects the man, the expectant parent. So that even includes men. So if your wife is pregnant, you can get moved to a high-risk pool. Isn't that amazing? It has nothing to do with you. But of course, insurance company bean counters, they're all about adding people to these pre-existing conditions so they can charge them more. All they want is somebody who is 20 years old, single, healthy, and rich. And with no medical problems whatsoever. Why? Because they want to extract more premiums from them and not actually give back care. So that's what that's about. Now, to the question, how often does lack of health insurance or lack of access to health care cause people to die? Well, I have some answers for you on that. Now, Labrador says, no, it absolutely doesn't. That's unfair. But as I'm going to show you from actual data and facts, that is incredibly fair. And that's actually what's going on. Now, researchers, and this is according to the Kaiser Family Foundation, have found links for years between health insurance and health outcomes. This should be no duh, no shit, no brainer kind of thing. Okay? Because people without health insurance coverage are less likely than those with insurance to have regular care, they are more likely to be hospitalized for avoidable health problems and are to experience declines in their overall health. That, again, that's no duh. When they're hospitalized, uninsured people receive fewer diagnostic and therapeutic services and also have higher mortality rates than those with insurance. And there are more and more studies that continue to back this up because, again, this is true, and anybody with an ounce of sense realizes that, well, if you don't have health insurance and you don't get regular checkups and you can't go to the doctor, well, of course you're not going to be as healthy and you're going to probably die sooner. But anyway, let me just rattle this off just in case I'm not convincing anybody with that common sense argument. A 2009 study published in the Journal of Public Health found a 60% higher mortality rate among uninsured American children in hospital settings. A study published in 2011 in the American Journal of Respiratory and Critical Care Medicine concluded that the uninsured have a higher mortality and receive fewer procedures when compared with privately insured patients treated at the same hospitals. Even more. A study published in 2009 in the American Journal of Public Health found a 25% higher risk of death among uninsured people compared with privately insured adults. The researchers calculated 44,789 deaths among Americans aged 18 to 64 in a single year that they said were tied to a lack of health insurance. That is nearly 45,000 people a year in 2009. Now, that number went down considerably after the AHCA expanded coverage. That number is about to go back up if the AHCA gets passed with Trump care. That's why we're saying it's going to kill people, because literally that's what happened before the AHCA. You're going to bring it back up to those numbers. It's not like the bill itself is going to come out and stab you in the gut or something. No, it's just saying that when you reduce access to health insurance by pricing people out of the market and taking away the tools to help people to be able to afford insurance, yeah, that's going to cause people to not be able to afford insurance, and then they will die. D-I-E, die. What part of that is hard to understand? Now, the study's lead author, that 2009 study, was led by Dr. Andrew Wilper. Now, he said the uninsured have a higher risk of death when compared to the privately insured, even after taking into account socioeconomics. So even if you're a middle-class person and you choose not to get insurance, you still have a higher risk of death. Isn't that amazing? I never knew that. I wouldn't think, because, well, I mean, if you've got the money and you would just go in to pay a doctor, right? Well, it turns out, no, having health insurance actually leads you to have better, healthier habits. So that's interesting. Now, Wilper also says, we doctors have many new ways to prevent deaths from hypertension, diabetes, and heart disease, but only if patients can get into our offices and afford their medications. And again, with this bill, that's going to be a lot harder. And look, even under the ACA, many people still had a difficult time doing that with high copays and high deductibles. Look, the other issue here is, again, we go back to the core of the problem. The ACA isn't a perfect bill. We know that. And it's based on a flawed premise. Privatized healthcare. Now, privatized healthcare, by nature, will always leave people out because they cannot afford the means to get that healthcare. And it's really, it's time to stop treating health as a commodity that only certain people deserve. Healthcare is a human right. It's what we pay the government to do. Now, Medicare for All is incredibly popular because it is the right policy. And people see that. People know that. And look, it's not like this is a foreign concept. We can look around to all the other nations that can actually do this. Right? They can actually afford this to cover all their people and to do so cheaper than we can per person. Again, there is no reason why we should be paying more for our health care and get less. We have the money. We just don't have the political will. There are too many people that do not believe that health care is a right for all human beings in America. But again, they figured it out. Now, what we should do is that any politician, left or right, that includes Nancy Pelosi, for example, who won't put Medicare for All on the Democratic, on the platform, well, then they need to go. And they need to be replaced with people who do believe that it's a that is a human right, so that they are more in line with the voters, with what we want. And it's the evidence is clear. Most Americans, a huge majority of Americans, want Medicare for All. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.